This video will demonstrate the process for a patient receiving medication for opioid use disorder services at the public health offices. It provides an overview of the workflow process from intake through completion of a visit. By the end of this video, staff will be able to understand the role of the clerk, nurse, provider, and support staff in a successful patient visit.
Hello, how may I help you?
My probation officer said I could come here and get some help with my addiction.
Yeah, absolutely. Go ahead and have a seat. Let's go ahead and get you scheduled for an appointment so we can get you the support that you need. Does that sound okay with you?
To help achieve the goal of low barrier care, the MOUD program has implemented alternative scheduling options. If an in-office visit is not possible, the NMDOH offers telehealth visits, an on-call provider schedule, a home telemedicine option, and a short-term bridging prescription pathway. All of these options are explained further in the MOUD protocol. In addition, NMDOH also leverages support from the helpline to ensure timely access to these life-saving medications. It can also be helpful to inform clients that they will receive a prescription for medication at the time of the visit. Most public health offices are not currently supplying medication for opioid use disorder.
And I actually see that Dr. Chu has an appointment available, so we can go ahead and get you scheduled. By chance, do you have any insurance?
No.
You do not? Okay, that's not a problem. We can still see you today.
Yeah, can we make this fast? I don't feel good today.
Absolutely. I just have forms that I need you to fill out. And once you're done with these, I will go ahead and take you back.
Okay.
As a reminder, clients entering treatment may be experiencing withdrawal, distress, or anxiety. All staff members play an important role in using compassionate, respectful communication to help create a safe, welcoming environment.
Hi, Randy. My name is Tia. I'll be the registered nurse taking care of you today. Let's start by getting your full name and your date of birth.
Randy Parson, 4/14/84.
Perfect. Well, Randy, my role today is to go over the intake process. As part of our program, we do collect urine. All right. Now, it's not used for reporting. It's not used in a punitive fashion. It's to help your care team to determine which treatment is going to be best for you. Okay. Do you understand that?
Yeah.
Wonderful. So we're going to proceed to the next step, which is the treatment agreement. Okay. This is the treatment agreement. Is it okay if I start getting with some vital signs? We'll get your blood pressure, your height, and your weight, and everything.
Yeah, sure.
Yeah? Okay.
Explanation of the intake process and visit expectations supports both the client and clinic staff in a more seamless and successful interaction.
Now that we got your vital signs, I did notice two things. One, your blood pressure is very high, and your heart rate is very high. I also noticed that you have some goosebumps on your skin. All right, those are indications that you might be starting withdrawal. Okay, do you feel like you're starting withdrawal?
Yeah.
Okay, well, let's get through this process really quick so we can get you to see Dr. Chu. Okay? Do you mind if I discuss your substance use and what substances you have a relationship with?
You said you're not going to tell my probation officer about anything we talk about?
No, ma'am. This is purely confidential.
Yeah, so I used to smoke meth and fentanyl. I was on Suboxone when I was in jail. When my boys picked me up yesterday, we smoked a little fentanyl.
Okay, so yesterday was the last time you used it. Okay.
That was the last time.
Okay, well, that kind of explains why you're having signs of withdrawal. Now what we're going to do is I'm going to escort you over to the restroom. We'll collect some urine, and then we'll get that information off to Dr. Chu so you can get to the next step, okay? Oh, hi, Doc.
Oh, hey.
Okay, so this next patient is Randy. She's new to the program, okay? Her urine did come back positive for both fentanyl and Suboxone, all right? And she does show some signs of some early withdrawal.
Okay, got it. Thank you, Tia.
You're very welcome, ma'am.
The nurse provides a warm handoff to the provider, including relevant clinical findings and test results. This supports continuity of care and efficient clinical decision-making. The use of non-stigmatizing language, even in conversation between staff, is essential. The language we use shapes attitudes, expectations, and quality of care clients receive. Non-stigmatizing language supports a culture of respect, improves trust, and helps ensure that clients receive equitable, compassionate, and evidence-based care. As a reminder, the provider may be virtual for the visit. If so, please educate the client on having a telehealth option. If the provider is remote, the nurse assists the patient with telehealth setup using an approved system.
Hi, Randy. It's nice to meet you. I'm Dr. Two. Can you tell me what brings you in today?
Yeah, I was on Suboxone in prison. I got out yesterday. I want to quit using fentanyl, but the withdrawals are really hard on me.
Gotcha. And I was talking to the nurse Tia earlier, and she did show me your urine. So it does show that you have buprenorphine, which is the Suboxone you were taking in prison. And it also shows that you have the fentanyl, which is what you mentioned that you were using. You want to talk to me more about what your drug use goals are?
Not really. I don't feel like there's goals. I need to quit smoking fentanyl, not go back to jail.
Okay. So I'll send in a prescription for you for the Suboxone, and we can finish up the intake and talk more about your drug use goals at the next visit. Do you know what dose you were on in prison, and was that dose working for you?
Yeah, they would give me a film in the morning, and then there's another one in the evening. And I think they were the 8 milligrams, and that was working all right.
So I'll send in a prescription for the 16 milligrams for you total, so that you take 1 8 milligram in the morning and 1 8 milligram at night. Can you tell me about what they told you about how to take the films?
Yeah, I would like have some water under the tongue, no smoking, no eating, just don't talk to anybody until it's gone.
Okay, perfect. Yeah, and you can also swish and swallow with some water after the film fully dissolves, but just don't brush your teeth for at least an hour. Do you live with anyone?
Right now, I'm staying with my ex-girlfriend, but I don't know how long I can do that.
Okay. I'm glad you have a place to stay for now, and we can help you with looking at some resources to get you stable housing in the future. Are there any children?
No kids live there, but her niece comes by over a couple days a week.
Okay. Do you have a safe space to put your Suboxone and other drugs that you use while her niece is visiting?
Yeah, I was gonna keep the Suboxone in my backpack, and I could probably just lock that in the closet.
Okay, and that sounds like a great plan. And I know you're not feeling well right now, but we usually get baseline labs before we start you on a new medication. How do you feel about getting some blood drawn today?
You guys can try.
Okay, so I'll have Tia, the nurse, take you over to the lab when we're done. Do you have any Narcan?
I could use a box.
Okay, so we can also get you a box of Narcan for you to take back. If you feel that the 16 milligrams of the Suboxone is not enough, I want you to give us a call or call the helpline. And if you're really not feeling well at all on it, I want you to go to the emergency room. And I'd like to see you again in 1 week to see how you're doing. If you're doing well, we'll see each other in every 2 weeks. And as you go, depending on how you do, we can extend out the visit longer each time. How's that sound?
Oh, that's fine.
All right, Randy. Well, it's really nice to meet you. I'm going to go ahead and get the nurse to come back so she can help you.
Thank you.
As demonstrated by Dr. Chu, NMDOH aligns with a harm reduction model of care. We remember that a patient must set their own goals for their substance use. Dr. Chu also allows space for the client to demonstrate their understanding of their treatment through teach-back techniques. She provides education about medication administration, storage of medication, asks about naloxone, and reviews program expectations with the client.
Hi, Randy. So how was your visit with Dr. Chu?
It's all right.
Okay. Here at the Department of Health, and here in our office in particular, we're very much about providing you with resources. One of the things we want to do is we want to make sure that you're successful, that you keep coming back, that you keep coming back to get your treatments. And what we want to do is we want to provide you enough resources that, all those things that do come up, transportation, housing, food, all those, we want to make sure that you're taking care of your holistic self. All right. So when we're leaving, we'll make sure that we provide you all that information.
I just don't know if I can do all this. My car's broken down, and I didn't know I was supposed to be here every week.
Okay. Well, it's only every week till we get to know you, until we can get an effective dose. We also utilize what they call telemedicine here. Are you familiar with telemedicine?
We do the visit on the phone?
Yeah, like on the phone. So what we could possibly do is we could have you with the provider, maybe not even here at the office. So we'll try to overcome every barrier so that you are successful.
In using motivational interviewing responses, the nurse has an opportunity to support the client in creating their own goals around treatment. Remember that the most effective change is the one that the client chooses for themselves. Additionally, ambivalence is a common part of change process. In this model of therapeutic communication, the discussion allows for shared decision-making, goal planning, and therapeutic encouragement for the client to overcome obstacles. In this scenario, Nurse Tia supports the client through use of reflection and then addressing barriers named by the client: transportation, housing, insurance, and scheduling flexibility. Assisting clients in identifying barriers to care and providing appropriate support can have a significant impact on retention and services. The helpline is available to assist both clients and staff in locating appropriate community referrals and resources.
So before you depart today, I want to make sure that we give you a box of Narcan. Are you familiar with Narcan?
Yeah.
Have you ever used it?
I have.
Okay. Have you ever used it on somebody?
Yes.
Okay. And you feel comfortable? Okay. Don't need a refresher or anything like that.
I know how to use it.
Okay. Wonderful. Well, that's one of the things. And then we'll give you a list of community resources and anything else you need to help you be successful.
Naloxone is provided to patients to prevent fatal overdose. If naloxone is not available for direct distribution at the public health office, patients should be informed that it is available over the counter or can be prescribed. Instructions for naloxone use should be reviewed with the patient. Patients are encouraged to carry naloxone at all times. Inform others where it's stored and request additional supplies as needed. This is also an excellent opportunity to inform patients about the New Mexico Department of Health Harm Reduction Program and provide education on safer drug use.
Well, right now I'm going to take you back out to the desk and we're going to go ahead and schedule your follow-up appointment, and then we can use that time to answer any further questions before you depart today.
This process demonstrates how clerks, nurses, and providers use a team-based approach to deliver timely, compassionate, and effective MOUD care. Each team member plays a critical role in supporting patients as they work towards their goals. Low barrier access, therapeutic communication, and coordinated care improve patient outcomes and save lives. Thank you for your commitment to making a difference in the lives of people across New Mexico.